Okay, my name is Dan O'Brien. I'm 63 years old, born in upstate New York, and currently reside in Fort Lauderdale, Florida. I was diagnosed with Parkinson's disease at the age of 58 and have been a professional musician my entire life, and noticed a slight trembling in my left hand, which is what triggered the idea of going and having it looked at and finding out that I had the diagnosis of Parkinson's disease. I went about 2 years basically doing nothing for it, just hoping it would go away, which obviously it didn't, until I had the fortune of running into Leslie Carmen again. And Leslie offered her services to try a treatment with a laser, which I've never been involved with anything to do with lasers. Wasn't really sure how it would work, if it would work, but certainly was willing to give it a try. And after spending, I think it was probably about 6 months of treatment with Leslie, I noticed a marked improvement in my gait, how I walked. Severity of my symptoms got considerably less. I felt better overall, had just a better attitude and a better perspective on life. And I personally, my personal belief is that the treatment that I've received through Leslie at Carmen Care with the laser treatment has absolutely slowed the progression of my disease. I'm almost 5 years into this now, and it should be considerably worse than I am. I lead a very normal life. I'm back to playing my guitar again as a profession. I run a recording studio during the day, and generally I feel very, very good. I really do give a lot of credit to Leslie and Carmen Care and the laser therapy that she was so kind to provide to me with making this disease much more manageable. And I really firmly believe, it's my personal opinion and my personal belief, that more people could benefit from this particular type of treatment. I think it would be a wonderful thing for people that are newly diagnosed with the disease to potentially stave off the effects of it, because it is a progressive, degenerative, incurable disease. I'm doing a very small dose of a thing called carbidopa-levodopa, which is a de facto standard that they give to Parkinson's patients, discovered in 1967. It has some very bad side effects, can have very, very bad side effects, not the least of which is if you take that medication for too long, you will develop a thing called dyskinesia, which is involuntary muscle movement. If you look at a gentleman like Michael Fox, that's what you're seeing when you see him. With the movements like this, it's not the Parkinson's, that's the fact that he's been taking the medication for as long as he has. The only other thing that they will do for you, or can do for you, for potential treatment, is a surgery, a brain surgery called DBS, where they basically drill holes in your head and put electrodes into certain portions of your brain and zap those portions of the brain to control the tremors. Now that involves putting a pacemaker into your chest. There's risk of infection. If you have any type of other underlying diseases which Parkinson's can cause, such as depression or things of that nature, it can manifest themselves really, really badly with the depression. So there's a lot of side effects that can happen with that also. I personally have felt no side effects other than feeling better with the laser. I thank Leslie, I thank the staff at Carmen Care.
Great. Well, thank you very much.
It's my pleasure, and I thank you for everything you've done for me.